Ladies and gentlemen, and welcome to Illuminations for our first talk of this morning's lecture program. It gives me great pleasure to welcome our flight talker today. So please give a nice hand to Captain David Henderson. Thank you very much.
Morning, Edward. Thanks very much. Thanks very much, Edward. Thank you. Thank you for that. Morning, everybody. A bit early in the day, I know, but thanks to all of you for coming in so early anyway. We've got quite a lot to get through. We're starting a little bit late, unfortunately, so I'll have to keep it going at a fair old lick today, I'm afraid. Now, when you're traveling by air anywhere in the world, you know that there's a problem when you hear the cabin chime going bing bong. Ladies and gentlemen, if there is a doctor on board, will he or she please make themselves known to a member of the cabin crew? Now, don't worry yet. It's probably not that both I and the co-pilot have eaten the fish, which is past its sell-by date, and they're looking for a doctor to see to us while they're looking for a hero pilot to come and land the aircraft for them. So, as I say, don't panic at this stage. But the chances of us eating the same thing on board the aircraft are negligible. We are required to eat separate meals on board the aircraft, which always seems a bit of a waste of time to me, because when we've been in the layover hotel the previous night, for breakfast that morning perhaps, we've eaten the same stuff in the hotel. So this law that requires us to eat different stuff on the aircraft is not necessarily going to preclude a case of double food poisoning. I always think of that rather wonderful spoof film called Airplane. Do you remember Airplane? It came out, oh gosh, it must be 25 years ago now, I think. And this was when the pilots had eaten the same fish, which was past its sell-by date, had become incapacitated, and they had to page for a pilot on board who was terrified of flying, and he then takes over. And this is the trailer to that film. I think it's a brilliant spoof.
Stand by for the most extraordinary chain of events ever swept up into high adventure.
Hey, Larry, where's the forklift? Forklift? It's over there for the baggage loader.
Airplane. Airplane is drama.
This is Dr. Brody at the Mayo Clinic. There's a passenger on your Chicago flight 209, a little girl named Lisa Davis, en route to Minneapolis. She's scheduled for a heart transplant. I want you to make sure that she's kept in a reclined position and that a continuous watch is kept on her IV.
Airplane is action. Airplane is romance.
I love you, Elaine.
I love you.
Airplane is music.
There is only one river, there is only one sea.
Airplane is dancing. Never has the screen been so big.
You ever been in a cockpit before?
No, sir, I've never been up in a plane before.
Peter Graves,
You ever seen a grown man naked?
Kareem Abdul-Jabbar,
My name is Roger Murdoch. I'm an airline pilot.
Leslie Nielsen,
This woman has to be gotten to a hospital.
A hospital? What is it?
It's a big building with patients, but that's not important right now.
Lloyd Bridges,
Johnny, what can you make out of this?
This? Well, I could make a hat, or a brooch, or pterodactyl.
Robert Stack,
All right, Steve, let's face a few facts.
And we hope you enjoy the rest of your flight.
Julie Haggerty,
By the way, is there anyone on board who knows how to fly a plane?
Can you fly this plane and land it?
Robert Hayes,
Surely you can't be serious. I am serious. And don't call me Shirley.
I gotta get out of here. I gotta get out of here. Down, get a hold of yourself.
Please, let me handle this.
I gotta get
Calm down. Now get back to your seat. I'll take care of this. Calm down. Get a hold of yourself.
Doctor, you wanted a phone. Everything's been cold.
Handle this.
Hey,
way.
All right, now everybody, get in crash positions.
The most incredible adventure the screen has ever created.
He's coming right at us.
The big news is airplane.
I think that was a great spoof. It was a spoof of all the sort of Charlton Heston airport and airline disaster movies of the 60s and 70s, and that sort of encapsulated all the corny bits that they did in those films. I think it did it rather well. Now, this one here, it didn't actually happen exactly like that, but it was very similar to that. In this one here, the lady passenger is saying to the stewardess, "Oh yeah, just leave his lunch. You'll be ravenous when he wakes up." Now, what actually happened was, this was on an EasyJet flight from Liverpool to Berlin, and it was I think in 2009. And an East German gentleman had been on holiday in Liverpool. I don't know why anybody goes to holiday in Liverpool. Oh, I didn't say that. But anyway, unfortunately, he had died while he was on holiday. And the cost of repatriating the body through an undertaker from Liverpool to Berlin was going to be £3,700, or somewhere in that figure. The one-way ticket on EasyJet from Liverpool to Berlin was £29.99. So what they reckoned they would do is they would buy him a ticket, they'd put him in a wheelchair with rigor mortis had set in by this stage, obviously. They would check him in, they would wheel him to the aircraft, they would then lift him out of the wheelchair, pop him into a seat, do the same at the other end again, wheel him off into the building, and just tell everybody that he was a bit old and a bit tired and was having a little sleep. They got to Liverpool Airport, they actually checked him in. They checked him in his wheelchair. It was only when they got to security that one beady-eyed security man or girl said, "Is your father okay? He looks a bit pale." And she said, "No, he's fine. He's just having a little rest. It's okay. Don't worry about him." So a security girl just put her hand out and put it on his hand to reassure him. And of course he was stone cold. And they were completely rumbled at that stage. But I thought it was a good try, and it might work on future occasions. I don't know. And the other one was a lady traveling back from Spain with her husband, who had also sadly demised on holiday. And the stewardess was coming around with the duty-free trolley, and she said, "Could my husband get his duty-free allowance as well?" And the stewardess said, "Certainly, madam. Where's your husband?" She said, "Oh, he's in the hold in his box." So unfortunately, she didn't get her duty-free allowance. Now, I didn't actually have a terribly good record in my flying career. I had 3 deaths on board and only 1 birth. Now, I won't tell you all the stories of the deaths. They all had their own sort of interesting aspect. But on one particular occasion, this poor lady, she was taken very seriously ill, and she effectively expired on board the flight. Now, the cabin crew are trained in CPR, cardiopulmonary resuscitation. This was before the days when we carried automatic defibrillators on board the aircraft, which we have now. But they were trained to perform CPR for 20 minutes. This has been proven to be a time when you can bring somebody effectively back from the dead. So they're trained to do this. They'd paid for a doctor, and this delightful little Bangladeshi doctor made himself known. He came up, and he examined the ex-patient, and the cabin crew were doing away with their CPR, and he said, "What are you doing?" And they said, "Oh, we're doing CPR." "Why are you doing CPR?" And they said, "Well, we have to do it for 20 minutes. He said, "You can be doing for 20 years. She is not coming back." And sadly, he was correct. The lady had left this earth for the next one. The 1 birth I had on board, as luck would have it, we paid for a doctor. Did we have a doctor on board that day? No. We had something much better. We had a midwife. Can you imagine the luck of having a midwife? She was a lady of certain age who had been retired for many, many years, But she answered the call and said, I'm not a doctor, but I do have medical training if there's anything I can do to help. And the stewardess said, you don't happen to be a midwife, do you? And she said, yeah. So, I mean, how lucky could you get? It was a totally natural birth. She was an Indian lady flying from Bombay to London, and she'd managed to smuggle the bump under a very loose-fitting sari. She'd been through security and everything, and people just assumed that she was quite a big lady, and she managed to get on board the aircraft, went into labor, wasn't her first child, a completely natural birth. So when it was all done, the midwife called me up and she said that everything's done, everything's fine. I said, do we need to divert anywhere? And she said, no, it's fine. Carry on to London. Mother and baby are doing well. Everything's all taken care of. And that was my birth on board. So that was it. Now, when we do have to divert on flight, it will be if life is at risk. Life is at risk or uncontrollable pain, either from a heart attack, from a multiple fracture perhaps, or from renal colic, kidney stones, things like that, where the pain cannot be controlled with the drugs that we carry on board the aircraft. And we carry some pretty spectacular drugs on board now. And we also have radio contact with medical advisory services on the ground if we do not, or if we cannot locate a doctor on board. So that's when we'd have to do that. Now, when we decide that we want to be pilots, we have to undergo a pretty searching medical, and they pretty much take us apart. We have to make sure that we have got pretty good eyesight. It can be corrected eyesight, but it has to be good corrected eyesight. So we have to have good long vision to be able to see aircraft away in the distance. This is made easier when they're trailing. By that I mean those white vapor trails that you sometimes see behind the aircraft. Or at night. It's much easier to see the aircraft with their flashing strobe lights at night than it is just that tiny little speck on the horizon by day. We have to be able to read our instruments, which are about the same distance as this computer screen. It's about arm's length away from us. And we also have to be able to read charts, our airport and our airways charts, which have got very, very small print on them, possibly not in the best lighting conditions. And we have to be able to read and make sure that we can read that accurately. Now, we also have to have color vision, perfect color vision, red-green especially. And we'll come to that in a minute. I'll give you a little test on that. But we have to make sure that we have perfect color vision, not just for the navigation lights, red and green navigation lights, but for other aspects, which I will show you again in a moment. Now, when we start out, they give us what's called a resting ECG. In other words, they lie you down on the bed, they connect you up to the ECG machine, the electrocardiograph machine, and they then get a trace of your heart's pattern of its working and resting beats to make sure that's all normal. When they're happy with that, they then leave you wired up, and they put you on the treadmill, and they make you go running along on the treadmill up a slope until your heart reaches its maximum output, its maximum stress output level. And they then make sure that those traces remain the way they want to see them. Now that, in the RAF also, they give us what's called an EEG, an electroencephalograph, when they wire the brain up to a monitor and see if they can detect any brain activity, which they can on some occasions they can. They would then show you pictures, various aspects. There might be a nice landscape, there might be a nice skyscape, there might be pictures of airplanes. And then interspersed with that, they would have a picture of a young lady who'd forgotten to finish dressing that morning, shall we say, and see what effect this has on the brainwave patterns. In my days, it was only a sort of page 3 type girl. I don't know what they show them nowadays. Now, in some countries, they also put a fiber optic television camera up your nose, which is not very pleasant. And they say that they are checking for any sinus problem by doing this. What they're actually checking for is to see if they can detect any use of recreational substances, shall we say. See if there's any white powder lodged up the old hooter there. They do blood tests, urine tests. We do motion sickness tests in a seat in a series of gimbals so that they can spin us upside down from side to side and what have you, to see if we're susceptible to any what they call motion sickness. They do psychological profiling to make sure that we are reasonably psychologically stable. Now, the coordination tests, those are all done by computer now. In my day, it was keeping a little speck of light in the middle of a cathode ray tube with rudder bars and control columns. But now it's all done on the computer. And what they do is they give you tasks while you are concentrating on your computer. They might give you mental arithmetic tasks to do. And they will eventually load this up, make it more and more difficult, very, very complicated stuff, until eventually the brain overloads. They don't worry about the brain overloading. They expect this to happen. It will happen, that the brain cannot process all the different sources of information. It can't process all that quickly enough to keep up with the task. What they want to see is how the individual copes with that failure, his apparent failure. Whether you have this feeling of frustration, perhaps, or panic, or a feeling of resignation, or acceptance of the failure. And the capacity to resolve the situation and get back in the loop once the level of pressure is reduced slightly. Now, I'm going to have to gallop through this bit just a little bit, as I say, because we are a little bit short of time this morning. I don't know if you remember this one. This happened on a flight from Hong Kong to London a few years ago when a young lady, she'd fallen off the back of a motorbike on her way from her hotel in Hong Kong to the airport, and she didn't think she'd hurt herself. She thought she'd maybe sprained her wrist, but what she'd actually done was she'd cracked a couple of ribs. So when they got airborne with the reduced pressure outside the aircraft, she was a very, very sick lady. They paged for the doctor. It was very difficult for him to actually carry out a diagnosis with the auscultation of the chest, and he decided that he would have to perform surgery on board the aircraft. And he did this using a coat hanger, which he used to introduce a length of oxygen tubing into her chest cavity. He gave her a local anesthetic before this. He used a bottle of aviation water as a drain seal. The brandy was used as a disinfectant, and the sellotape was used to connect up different bits of tube. Now, that is incredibly wonderful lateral thinking, if you like, on the part of the doctor. So to be able to actually save a woman's life using the absolute minimum equipment was an absolute tribute. On this particular occasion, I think British Airways could say, we take more care of you. Now, I don't know if we've got a big enough sample here to make this really worthwhile. Have we got anyone who knows that they have a color blindness problem? Yes, excellent. One. Okay. Yep, that's very good. Just the one. Okay. I thought there might have been a few more than that amongst the men in the audience, because men are much more susceptible to color blindness than women. So let's just have a look at that. Can we see any numbers there at all on this in the splodges? 6, 8, 8? No. Nobody's seeing anything. No. Okay. 6. Okay. 6, right, very good. Yeah, it is a 6. But people with a certain color, we don't call it color blindness, we call it color perception abnormality nowadays. And this one here is sorry, that's another 6. That should be a 74. Nobody's seeing 21, except that gentleman up there. I thought he might. That's the classic one. If you see 21 as opposed to 74, indicates that you have a mild color perception abnormality. And just this last one here, 29, and the gentleman at the back sees nothing. Am I right? No, not saying anything. Fair enough. Anyway, as I said earlier, it's not just for to be able to see the red and green navigation lights. We must have good color vision because we have so many different color inputs now. Now, in the old days, we used to have, before aircraft even had radio, they would have a series of either lights or Very flares, which the control tower would send up to give various instructions to aircraft both on the ground and in the air. And these would normally be red, green, and white. And they had different meanings depending on how the light was flashed or how the light was made steady, whether it was green, whether the aircraft was in the air, all these things which we had to then memorize. And we're still supposed to know them for our basic training. So if you remember that port is red, and should be left well alone. You will never forget which is which again. Port is red and should be left well alone. But we also have now in the flight deck, obviously, television screens. As opposed to the old instruments, like the instruments in your car, the old analog instruments, we now have predominantly television screens, which show us all that we need to know. So the basic flight, well, it's a bit blurred, sorry about that, but the basic cockpit itself, there are so many different colors there. We've got greens, blues, reds, browns, whatever you, magenta they call it. I don't know why they call it magenta. It's a sort of purple color, but that's our flight deck. Obviously, it's vital when we're looking, I don't know why that's so blurred, sorry. That's our radar, which is looking ahead for bad weather ahead. And obviously, in this situation, red and green, accuracy of vision is absolutely essential because, fairly obviously, the areas of green around the edge of this band of weather here, bad weather, indicates it might be a little bit bumpy, might be a bit of precipitation, a bit of rainfall. Amber and yellow means, yeah, you want to avoid that if you can, really. And the red, of course, means do not go here. You do not really want to be in that red area there because you're going to hit either very, very heavy rainfall or you're going to be in moderate to severe turbulence. Now, also on board, of course, we have, you probably recognize this as what would be called the artificial horizon in old days. Nowadays, it's called the attitude direction indicator. And it's basically just an artificial horizon. They keep it nice and simple for pilots in that the blue is the sky and the brown is the earth. We do our utmost to keep it that way. Because if we ever get those the wrong way round and we finish up with the brown at the top, it means that something has gone wrong and we are probably about to spill your gin and tonic, which you don't thank us for anyway. But you'll see all the different colors here, the reds, the browns, the yellows, the blues, the greens. There's a lot of information on there, all compacted into one instrument, and we must have the vision, the color vision, to be able to see and interpret all that. Going on to the external tasks, of course, on the approach to the runway, we have our runway approach lights, which are a series of crossbar lighting with a center line light leading right down to the threshold of the runway, where there are green lights across the end of the runway there. And we have to try and stay in between these two red lights with the center line of the aircraft tracking right down the center line there. And then here, further down, you can just about make this out. We've got white, white, red, 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 white, white. And these are what are called PAPIs, precision approach path indicators. And these tell us whether we're high or low on the approach. So by using all these various combinations of lights, we can build up a very good picture, even in conditions of poor visibility. Not in conditions of no visibility, because we won't see any of that until we're very, very close into the runway. Moving on to our balance organs. This is, it would take forever to go through this with you. So again, it's going to be a fairly quick introduction to it. And that's your ear, that's your ear hole there. That's your eardrum. This is the cochlea. And these little yellow jobs here, these are what are called the semicircular canals. And in our semicircular canals, there are three little tubes, circular tubes, and they're at right angles to each other. So each time you have a movement, these little tubes, they're filled with fluid, and there are little hairs in them as well. And these tiny little hairs have got tiny little stones, effectively, on the end. And these move around in the fluid and send information to the brain as to which way is up. Now, this is fine for us when we're sitting here on the ground watching something which is fixed. We know where the horizon is. We can see that. And the information we're getting from our semicircular canals will tie in. It will agree with that information. However, for reasons that we'll come to in a minute, we can sometimes get very confused by our balance organs. Okay, so that's the cochlea part. That's to do with the hearing, and we'll say that these are to do with the balance. Okay, so when we translate these into our problems in flying, we have our three spheres of motion. We have a pitch that's moving our head up and down like that. We have roll, which is moving the head backwards and forwards like that. And we have yaw, which is from side to side. Now, if we do all that at the same time, we can lose our balance. Probably remember that silly old game, some of us, silly people used to play in our youth when you've had a couple of beers at a party, and you get a broomstick, and you put it on the ground, and then you spin round it half a dozen times and then try and walk. You can't do it because your balance organs have all been upset by this very, very strange swooshing of liquid in these semicircular canals, sending information to the brain, and then you walk off, and if you've had too much to drink, you fall off the edge of the stage and you break your leg, which is not the object of the exercise, really. So that's it, pitch, roll, and yaw. Now, when we look more closely at the ear, we can see this little tympanic membrane here. That's our eardrum. So when we're coming down, we have increased external pressure pushing on the eardrum. Now, as long as this chap here, this is called the eustachian tube, as long as that remains open at this part here, then the air will balance, the air pressure will balance on either side of our eardrum. If this little chap here gets blocked for any reason, if you've got an upper respiratory tract infection or cold, a blocked nose, or some throat infection, then this chap here can get blocked, and the pressure then will not equalize. And that is when you get that pain in the tympanic membrane. And the thing you can do to try and do this is, first thing to do is just move your jaw up and down. And if you do that now, you'll probably find you can feel a sort of clicking sound in your ear as you move your jaw up and down or side to side. If it doesn't clear, then what you can do is just take your nose just below the bridge, pinch it, and blow gently through your nose. If that doesn't clear it, don't overdo it. Don't do that to excess. The other thing which is worth knowing is if you happen to be on board and you see a young mother traveling with a baby, and the baby is crying in the descent, don't try and pacify the baby, because the baby is probably in pain. It probably can't clear its ears, but the very action of crying itself will help to open up these tubes and equalize the pressure. So don't try and pacify any baby during that part of the flight. These balance organs here, these were effectively responsible for the death of John F. Kennedy and his wife and her sister in a plane crash off Martha's Vineyard in 1999. I don't know if you remember the case. It was called The Further Curse of the Kennedys, where John F. Kennedy Jr. he'd had instrument flying lessons, but he was not qualified to fly on instruments. He'd taken off in a very high-performance, single-engined aeroplane to fly from somewhere in New Jersey up to Martha's Vineyard, where they had their holiday home. And going into Martha's Vineyard at night, it was hazy. There was no natural horizon, so he could not see a horizon. There were stars up there, a bit like looking up at the ceiling there now. There were stars up there. There were lights on the ground. He became disorientated, and he did not have the training, sufficient depth of training, to be able to latch onto his instruments and fly the aircraft purely by reference to instruments. What happened was they got into what's called a graveyard spiral. And as this happens, the pilot's tendency is to pull back on the stick because he feels that he's descending, which he is, but the fluid in the ears at this stage that stopped moving around. It has stopped sending signals. He would have felt himself being forced into his seat, flying by the seat of the pants, it's called, for good reason. And as he went down, he would have pulled harder to try and stop that descent. But all he was doing was tightening that spiral, and they spiraled down and down and down until they hit the water, and all three of them were killed instantly on impact, tragically. The other thing which we can get, of course, is sinus block, which can be absolutely excruciatingly painful. I had it once going into Amsterdam, and I was in absolute agony. We had to throw the approach away, climb back up again, depressurize the cabin very, very, very slowly so that it didn't recur, so we could get the aircraft safely on the ground. Because it was part of my job, I, of course, had to have the operation, which they do to clear the sinuses, which is not very pleasant. They put you to sleep, fortunately, and then they get a big Black & Decker drill and stick it up your nose, and they drill out the sinuses and make those areas a little bit bigger so that they don't get congested and blocked. It's not very pleasant, and I don't recommend you undergo it. Now, The other thing which we have to be careful of, I don't know if we've got any divers with us, any scuba divers on board. Yeah, but you will know more about this than I do in that case, because I'm not a diver. But you have to be careful about diving and then flying, especially if you're diving to more than 100 feet within 24 hours of flying, I think it is. As I say, anybody divers, this is one thing which is drilled into you right from the first lesson on diving. Hyperventilation can affect quite a few people, especially if you're nervous about flying. If you're concerned about anything that's going on, then you may find yourself hyperventilating. It's quite normal if you're under stress. But what you're effectively doing there, the atmosphere that we breathe, is made up of about 80% nitrogen, 19% oxygen, and just other trace gases. Okay? Among these is carbon dioxide. And what we're doing when we hyperventilate is we're washing